I'm Dr. KOMAL, Assistant Professor, Department of KOMAL VIDHYA, Faculty of Ayurvedic Science, VIDHYA, University, Jaipur, Rajasthan. So, today's practical session, we will talk about the urinary system examinations of children. So, in this session, we will discuss about the anatomy and physiological peculiarities of urinary system in children, semiotics of the main syndromes, laboratory and instrumental examination of urinary system in children. The main part of the urinary systems are kidney, ureter, the urinary bladder, and the urethra. The location of the kidney. The two kidneys lie against the muscles of the back in the upper abdomen. Each kidney is enclosed in the membranous capsule. The kidney as well as the ureter lie behind the peritoneum in the retroperitoneal space. The function of the kidneys are regulation of the volume of the extracellular fluid and pH of the organism, excretion of the toxic substance or the waste product of the human metabolism that should be removed from the human body, production of renin, the enzyme which is important in the regulation of blood pressure, production of the hormone erythropoietin, which stimulate the production of the blood cells in the red bone marrow. So here is the whole urinary system has the three stages of the development. First is the pronephrons, mesonephrons, and metaphrons. Pronephrons is the first stage, the dorsolateral caudal position, no excretory function. The second stage is the mesonephron. Its origin in the fourth week of the gestation, development as the tubular part of the collective tubules and the cloaca. The third stage is the metanephrons. The final kidney develops into two parts. So development of the kidney. Again, the budding of the mesonephrotic duct grow and differentiates into ureters, calyx, and connective tubules. Along with the development of the tubules, the mesoderm accumulate and regroups around them, forming the capsules of the glomeruli. And the parenchymal cells multiply more rapidly than visceral. Capillary systems enter Bowman capsules and forming future glomeruli of the kidney. So here's the development continue. Simultaneously, the tubular part of the nephrons develops later, being fused to the collective duct of the mesonephrons. The formation of the final kidneys goes on the pelvic part of the body. The development of the urinary organ, they ascend in the lumbar part and locating retroperitoneally. So simultaneously, the rotation of the kidneys start at the final position. They are being shaped, and their convex margin is faced laterally. The normal development of the urinary systems result in the formation of different malformations. Cystic kidney, renal agenesis, aplasia, dislocations, S-like kidney, L-like kidney, horseshoe-shaped kidney, and so on. So placenta play a role of kidney before full development of the urinary tract is finished. So the anatomical and morphological peculiarity of the kidney is relatively big size, lower position of the kidney up to the 2-year, and the age of the 5-year. In the older children, the structure of the kidney is similar to those of adult. So anatomically and morphological kidneys continue. Nephrons is not fully differentiated before 2 years. The Bowman capillary layer is covered by the cubical epithelium cells. They make the filtration difficult. At the age of 2 to 4 years, cubical epithelium exists only in the small foci of the kidney, mainly it is replaced by the plain one. So urinary lymphoid system has a connection of the GI lymphoid system, which contributions to the contamination of the urinary system is the GIT microbes. The urethra has bigger diameter. They are relatively longer, so they form a folder and loops. The urinary bladder has a poorly developed muscular layer and elastic tissue. Conversely, the mucus is fully developed and well vascularized. The urinary bladder in children is smaller, has a higher position than the pubic symphysis, which makes the palpation and puncture easy. In the position of urinary bladder is high, the urinary bladder has a poorly developed muscular layer and elastic tissue. Conversely, the mucus is fully developed and well vascularized. The urinary bladder in the children is smaller and has higher position than the pubic symphysis, which make the palpation and puncture easily. The urethra is a shorter and poorly developed elastic fiber and connective tissue. There is a sexual difference in the length and the age of the urethra. Urethra length is a 5 to 6 centimeter in boys and 1 to 2 centimeter in girls. So due to the shorter urethra in the girls, the possibility of the retrograde infection increase. The volume of the urinary bladder in newborn is 50 ml, at the age of 1 year 200 ml, and the adult is 400 ml. So the daily amount of the urine is 1 month child is 200 to 250 ml, and the 1 year is 600 ml. The daily amount of the urine in children at the age 1 to 10 year can be counted by the following formula: 600 plus 100 in bracket n minus 1, and the n is age in years. There is a difference in the chemical content and the osmolarity of the urine, which depend on the age. The osmolarity of the urine is the lower. The connect of the uric acid is the final urine is higher at the 3 to 4 day of the life, often resulting in kidney infractions. So that's all about morphology and anatomy of the urinary system in the children. In the next session, we will talk about examination of the urinary system. In this session, I want to clear how many peculiarities in the children's than adults. So in this session, it's a just brief clarification about anatomy and morphology, peculiarity of the kidney in children. So that's all. That's all about this session. Thank you, and we will meet in the next session. Thank you.